I'm Kersten Gutschmidt. I'm with the chemical team. I have been with the organization for nearly 20 years, working on different environmental health and chemical issues. My involvement in chemical risk assessment is first related to emergencies. I've been doing rapid risk assessment in emergencies from the desk, but also in the field. Secondly, we are developing guidance material for emergencies, but also for regulatory purposes, where we're dealing with chemical risk assessment. And as part of that, I'm also involved a lot in capacity building activities. As part of that, we have developed quite a few case studies on chemical risk assessment, which could be of interest to this project as well.
My name is Joanna Tempowski. I'm also in the chemicals team with Kersten. I've worked at WHO for about 12 years. And my main area of work is on poisoning and on poison centres. So before coming here, I used to work for a Poisons Information Service where we did clinical risk assessment every day. Now that I'm at WHO, as with Kersten, most of the work that I do on risk assessment involves helping countries to deal with emergencies.
And a rapid risk assessment team, which is in the field, is confronted with an uncontrolled release of a chemical, for example. Then this team should be aware that chemical expertise is not only available in the Ministry of Health, for example, in Poison Center, but also is available in other ministries. Ministry of Environment, laboratories, for example. Exposure assessments expertise is often available there as well. We have expertise often in the Ministry of Agriculture dealing with pesticides, fertilizers, when it's about these substances. Toxicological expertise is sometimes available in the Ministry of Labor in the context of occupational health, which can be hosted in that. So it's very important to think beyond the Ministry of Health.
If you are in a team in the field and you're planning an investigation into an outbreak that you think is caused by a chemical, I would advise at a very early stage to get toxicological advice about sample collection. Either you can ask a toxicologist if you have one in the country, or you can direct an inquiry to WHO. But that's important because the time frame, if you're talking about biological samples, the time frame for having a sample in which there will be chemical present is relatively small. And so you have to get your samples quickly, but you have to get the right samples, because there are some types of chemicals that are better analysed in urine, some that are better analysed in whole blood, some that are better analysed in serum. Sometimes the material of the container can make a difference. If you're looking at organic solvents, for instance, they can migrate through a plastic container. And you may only have one opportunity to collect those samples. So it's important to get the advice first before you start collecting the samples, so that you don't waste resources and you don't waste people's time.
Yeah, finally, there is quite some information of chemicals outside in the world. And I'd like to raise the awareness about especially the information provided by the international organizations. You can imagine that each country, especially in the Western world, has its own databases. But I recommend to the international rapid assessment teams really to refer to international databases, which I'd like to mention the WHO toolkit for the human health risk assessment of chemicals. There's the database, the INCHEM database, which also the chemical team can be approached preferably through the country and regional offices. And then we can mobilize our networks as well. So